So, Ishi ma'am, coming right to you, and we've seen this increasing trend in the incidence of IBD also over the past few years, not only in India, but all over the globe. And is there some kind of etiological factors that you feel are contributing to this increase, or is there something else you'd like to add related to this point, ma'am?
What I'd like to just say is that certainly what we call a typical westernized diet is contributing to this increase, and it is highly correlated with urban and rural differences. And I think, to my mind, that more than anything else, that is the biggest, what I call the change in the ecosystem, whether it's the Western diet, or whether the urban lifestyle, or the urban ecosystem. That together has probably contributed, and maybe it's difficult to isolate one factor. But coming to inflammation through food, there is one clear fact that typically inflammation in our bodies, the chief contributor is food. All the other things, factors are there, which probably exacerbate the conditions. But clearly, food is one of the key things which is contributing. And we all know how foods have changed, how agricultural practices have changed, how much refined food we are taking, how many additives we're taking without knowing. So that's a part of our industrial food production, and the pesticides, of course, the use of high, the GM crops, high glyphosate consumption, when we are not at fault. It's just a part of the ecosystem. And I guess, the stress factors that all are adding to it. But the most profound factors are in our diet itself.
Sure. So very, very enlightening, ma'am. So I was reading only yesterday that it's not what you eat, but also how you eat. So there's a particular order also in which your starches are supposed to come at the end of the meal also. We'll discuss about that another time. Dr. Raj, that's very well explained, and I meet patients on a daily basis when they ask me, "Is this test a yes or a no?" And for me to tell them that this is not black and white, this is only a gray zone. It needs to be clinically correlated. You
Okay, I
put it
always
very,
quote
very well.
you. One of the first things one of my professors, right in first year, had said: in medicine, never say never and never say ever. So there's no test which is 100% accurate. There's no test which is 100% positive predictive or negative predictive.
That's right. Even my father says this all the time that you're not treating the report, you're treating the patient. So it's always the correlation that matters. So Mrs. Khosla, coming to you, my apologies, I couldn't come back to you before this. But there is a huge role, ma'am, obviously, that diet plays in controlling the flare-ups of IBD. Obviously, therapy and medications is extremely important, but also that we see that the exacerbations that you have are directly proportional to what kind of diet you're taking. Also, I've read and heard that there is a huge role of integrative medicine, maybe other kind of therapies like yoga or anything else that you can tell us about. And for the audience watching today, also any pearls of wisdom from your side?
Yes, I will certainly answer your question, but I was very tempted to add to what has been said by Dr. Tom and by Dr. Raj about tests and about gluten. So that maybe a food intolerance test would also be of value to the protocol that is being followed. And that the TTG, which is the tissue transglutaminase antibodies, or the endomycelial antibodies to rule out celiac disease, also need interpretation, just like the food intolerance and the food allergy tests. And I don't think food allergy test really has a role to play, a big role to play compared to the IgGs. But interpretation of a negative TTG, and I really request Dr. Tom to highlight, while so many people seem to be having a negative or TTG value, and we know that the problem exists, the classical picture is there, and yet we allow them to just be untreated. So what would you like to say about a negative TTG? And also another point before I move on would be talking about wheat in perspective to gluten. and the other parts of wheat, which is, the non-protein parts, which are the FODMAP category, which again, I'd like Dr. Tom to elaborate.
Mrs. Khosla, just to conclude this integrated therapy to control and monitor your IBD symptoms, is there something else apart from your diet also, like yoga and other things that Mr. Chandwani was mentioning? Maybe a quick comment on that.
Oh, yes. Since we're talking about the gut microbiome, the bugs don't like stress and toxic environments and toxic emotions. So any strategy or tool which helps to relax and calm your environment and calm your inner system is going to be of value. And that's what yoga is all about. And regular physical activity also is important, but too much or excessive can be counterproductive. That is clear. Also, to just highlight what Mr. Chandwani was talking about, that whenever he took the triggered foods, which were what we eliminated, he always relapsed. And there was a time when he was not symptomatic, but he started dairy in small amounts, and he probably did not have obvious symptoms, and he became bolder and more took more risks with his diet and started having it regularly on a daily basis. And that's when he had his flare up again, and all the bleeding and everything started. He had to be put back on medication, and bit by bit, we've healed him back. And so he's on probably almost nothing, or very small dose or nothing these days. More than anything else, apart from the elimination we're talking about, it's very important to add the right elements as well. And since your question on diet remain unanswered, I'll take this opportunity to highlight some key parts of a diet, particularly on a long-term basis. In the acute phase, of course, elimination of the trigger foods is important, and low fiber diet is important. And having healthy fats is also important, the right kind of fats, which are anti-inflammatory. And I think in all our webinars, we've been talking a lot about these omega-3 fats, which have been found to be useful, the fish fats, also several, plant versions of these fats like chia seeds, etc., are good. But also the nutrients, the micronutrients, because these people are really suffering from malnutrition. And, besides all the dysbiosis, and maybe because of the dysbiosis and the state of the gut, they are usually very low on iron or low hemoglobins. They have low vitamin B12, vitamin D, calcium, magnesium, folic acid. So all of these, and magnesium is very, very important actually, because we tend to ignore it in favor of only calcium. But we need to up these and make sure that they are really brought back to optimum levels through supplements. And needless to say, since we are talking about the microbiome and the dysbiosis, the importance of probiotics and prebiotics, which is really very, very important. And by and large, once the patient's symptoms are under control, more or less, it's a normal diet. They can have normal proteins and easy to digest food, of course. And we haven't still spoken about FODMAPs, which is the certain kinds of sugars in our foods, which can also be adding as trigger foods to, like fruits, etc. So over to you, Tom, to talk about that.
Oh, thank you. I just want to be clear that we are not saying it's okay to cheat once in a while. Yes. Because by the time you feel symptoms, the fire in your intestines has been going on and going on. You don't feel symptoms right away when you take in something. Usually you don't feel symptoms right away, especially when you're recovering and you're symptom free. And then you take something in, and some doctors call it cheat days. It's okay to have a cheat day. No, it's not, because the fire continues right away and it's going to cause damage. And it's only after you cross a particular threshold of damage that you start feeling the symptoms. You don't feel the symptoms right away. So cheat days are never okay. And what I've said for years, You cannot be a little pregnant. You cannot have a little wheat if you have a problem with wheat or dairy, or it doesn't matter what it is. So I just want to make sure we're clear on that. We are not advocating have a little bit once in a while, as long as you feel fine.
And I would take this opportunity again to come back on this and say that a lot of people, even in eateries, say, oh, are you celiac? Or you're just not, just avoiding it. So we will be vigilant if you're celiac, and if you're not, we will be a little easy. Because that's the message which goes across, that, you can have it on and off just because you're not celiac. So I think that's really important to highlight. And of course, we also need to add some anti-inflammatory herbs, and which are, so integral to the Ayurvedic concept. You talked about the integrated medicine, the holistic approach. So in India, we have so many herbs. We have ashwagandha, we have giloy, we have boswellia, we have curcumin, that's the king these days, and so many other, digestive herbs which can support the system and build the architecture and reduce the inflammation. I would simply say these are action points that clearly know your trigger foods and avoid them scrupulously. Also, it's not only about what you eat, but it's also how you eat, when you eat, and how much you eat. So watch your parameters, watch your BMI, watch your waist, and all the foods that you eat to maintain your statistics, and also monitor your blood work. That means keep track of your markers and be in touch with your treating physicians, and really make this a way of life. And like Dr. Vivek Raj just said, if you do that, you're not only helping your gut, but your entire body and every cell, head to toe, inside out, and from your mind to your physical body. So
great, thank you.
Simple takeaways there.
Thank you. Vivek sir, anything from your side for the audience to take home and remember from today?
So I think for the IBD patients, very important, that's a lifelong disease and it has to be monitored, and even when you are well. So don't visit the doctor only when you are unwell. It is when you are well that a lot of the advice will sink in and a lot of things will be preventive. When you are unwell, then you will just be treated for the disease. But when you are well, that's when a lot of the preventive aspects will come in. So stay in constant follow-up, whatever the duration may be, with your doctors. Also, dietary advice, as Ishi has already said, and my dietary advice, and my buzzword these days, jungle diet. So stick to a lot of high fiber, lots of fruits, vegetables, natural foods, avoid processed foods, definitely avoids alcohol and smoking. Something that decreases the risk of cancers everywhere and decreases the risk of pancreatitis, inflammatory bowel disease, multiple things. Be aware of specific, don't be a complete exclusion diet, because a lot of patients come in. My neighbor told me to stop eating this. My doctor, I read on Google, so Dr. Google actually that is the biggest problem these days. So I did my research and I have done this and I stopped this, and this. So if you're excluding too many things from the diet, then you are going to have nutritional deficiencies, which will be counterproductive. So one has to do this in a discussion with your physician as to what to avoid, how long to avoid, how to monitor your diet, what to build up, what to build down. As Ishi rightly pointed out, micronutrient deficiencies, vitamin deficiencies are extremely common. We got to be very, very aware of how to build that up, because that builds up your immunity, that builds up your, it decreases the risk of your heart attacks as well. Atherosclerosis related to vitamin D deficiency, inflammatory bowel disease related to vitamin D deficiency, many different things.
Thank you, sir. And Dr. Tom, I always like coming to you the last so that we can finish the session also with something very interesting. And is there something that you would like to share with us?
Oh, thank you. I fully agree with what Dr. Raj has just said. Stay in communication with your doctor if you've been diagnosed with an inflammatory bowel disease. But not all doctors are educated equally. So the doctor that identifies your disease and helps to keep you stable may not be the doctor who's been trained and understands about dietary influences. So you have to ask a couple of questions with respect to your doctor, but you have to kind of see, what do they know? what training do they have? Or can they refer you to a dietitian? In other words, you have to make sure the experts that you're using to trust are educated in the field that you want more information. And one of the ways to help with that is go to the Celiac Society of India's website and start reading, and just 1 hour a week. If you allocate 1 hour a week, you tell your family every Tuesday night after dinner, every Sunday after services, whenever it is, but at this time, don't bother me. I'm going to learn more of how we as a family can be healthier. And now you're going to learn a little bit more 1 week about where some of the inflammation comes from. And then next week, you're going to learn something new. And then next week, you're going to learn something new. In 6 months, you've got this. You've really got it. So be kind to yourself. Don't expect to understand how to change your lifestyle in 1 day. And you will feel overwhelmed by all of the information, but just put your toe in the water a little bit at a time, 1 hour a week. And then next week, you'll put your ankle in the water 1 hour a week, that you just learn a little bit more. And in 6 months, you've really got this.
Great. Thank you, Dr. Tom. And obviously education awareness is critical, and we couldn't agree with you more. And thank you, everyone. Thank you so much. And it's been enlightening as always. And I've been taking mental notes, and I think we had hundreds of attendees in today's session. So I think, and I hope it was productive for everybody. And if there are any attendees who have a question, then Arjun, please do share the email ID or the communication link through which they can reach out to us, and we can resolve their queries as well. And thank you, Mrs. Khosla and Dr. Raj and Dr. Tom O'Brien. Pleasure and a privilege, like always. Thank you.
Thank you, Dr. Arjun Dang, for